Hello, and thank you so much for joining us this evening. We're so excited to have you all joining us for another really exciting topic. Welcome to our Autism Exploration series. If this is your first time, I am so excited that you're here with us. My name is Emily. I am the Clinical Director of Field Services here at Verbal Beginnings. And the first thing I like to talk about is Verbal Beginnings' mission, which is to change lives for our clients, families, and our professionals. And one way that we do that is through our pledge of care, which is our promise to you, the families, to provide effective treatment through compassionate care. We also strive to achieve our mission through our core values. One of our core values is education. And one way that we do that is teaching families valuable ways to work with your child, which is why we've decided to start the Autism Exploration series. Additionally, you'll see below on the slide, we have the seal of Behavioral Center of Excellence, which represents the hard work and focus that we place to ensure that Verbal Beginnings is providing quality care through the highest of standards. And we continue to receive this accreditation and strive to do better each time. Stephanie, you can move right to the next slide for me, please. Thank you. I also wanted to take this opportunity to introduce you to the services that we offer here at Verbal Beginnings. So in addition to our in-home and center-based ABA services, we also offer diagnostic services, feeding therapy, and social skills programming. And you'll get to hear some more about other things going on at VB from Stephanie tonight. Additionally, we encourage you to participate with us today throughout the presentation by using the Q&A feature found at the bottom of your screen. We also offer closed captioning during this recording, which you can access by navigating to the bottom of your Zoom screen. Click the closed captioning button on the bottom of your screen, and that should get that started for you. And we'll also have polls launched throughout the presentation, so we highly encourage you to please participate in that as well. And without further ado, I'd like to introduce you to our presenter for the evening, Dr. Stephanie Nostin. Take it away, Stephanie.
Thank you, Emily. Hi, everyone. Very nice to be here. So I'll start off by telling you a little bit about me. Who am I, Stephanie? So my name is Dr. Stephanie Nostin, and I joined Verbal Beginnings actually in February of this year, and I'm very happy to be here and thrilled to be part of such a dynamic and strong team. And I am the Director of Comprehensive Services at Verbal Beginnings. And so my job and mission here is to incorporate, as you'll hear more in this presentation, speech and occupational therapy services into our autism services model. And so a little bit more about me in terms of my education and background as a professional. I am a licensed speech language pathologist in the state of Massachusetts and certified through ASHA, the national organization, and soon, hopefully, very soon by the end of this week, I'll be licensed in Maryland too, yay, which is super exciting. And I'm also a board certified behavior analyst, and I am licensed in Mass and soon to be Maryland. And so, again, my mission is to really bring a lot of focus on the integrated services model and interdisciplinary collaboration. And so that's me as a professional. But I think it's important for you all to know a little piece about me as an individual and a person too. And so, like probably the majority of the individuals within this meeting, I am also a person and I am a parent. And so I have 3 children, and I have a 10-year-old, I have a 3-year-old, and I have a 1.5-year-old. And my 10-year-old daughter, Ryan, was diagnosed with epilepsy when she was 3 years old. And so from a mother's perspective, I definitely understand the importance of integrated services. I know what it's like to live in a hospital and have information just kind of thrown at you daily. And for me, having a team that was so amazing in Boston Children's Hospital work together as a team and in an integrated model and approach was so reassuring and refreshing to me as a parent. It lessened my anxiety, and it also helped me provide my daughter with the best possible services and make the best decisions for her. And so I do relate and empathize on a number of in a number of ways with a lot of the individuals that are here tonight. And so that's a little bit about me. And so let's move forward with some of the great information that I have for you all today regarding what is an integrated service model and how do you integrate speech and occupational therapy into ABA services. So first, let's talk about what integration looks like. And I love these pictures here because integration can take many shapes. But specifically, if you look at these pictures, you see smiles. I think that's the most important piece. Integration is fun. Yes, it potentially includes co-treating, it includes consultation, it includes training with multiple people from different professions, but most importantly, it's fun and it's effective. And so if you look at these pictures, yes, you clearly see a client. You see in one an older individual who's learning to use an augmentative alternative speech device. And you have a speech pathologist and another professional, perhaps an occupational therapist or a teacher or an ABA therapist. And they're working side by side with the individual and in the best interest of the individual. And then in the other picture, you see a cute little kiddo, and he's learning a series of skills. And you can see he's having fun. He is learning within clearly an activity that he enjoys. And he's being taught, again, by two professionals at the same time. And they're there really working for his best interest and meeting him at his level. And so I think the big thing about integration is if it's being done well, it is exceptionally effective. And, it includes all stakeholders. And we'll talk a little bit about what I mean by stakeholders further on in the presentation. So here's another example. I love this video specifically because it gives a really good example of what integration can look like in a specific therapy session. And so I'm going to play this video for you. I've shared my sound, and we've tested it, so you should be able to hear. And this will give you a little bit more of a picture of what I'm talking about.
So if I do it, he will do it.
Yeah. So next time, do I
Self.
on yourself? Yes.
I-E.
Yeah.
I know he's waiting for me to take him away. All right, my turn. Ready? There you go.
Good.
Hi, buddy. Look at you.
Okay, try this, Chelsea. Try some behavioral momentum. So say ba, say ba, say ba, say bye.
Okay. Say ba, 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 ba. Bye. There you go.
Yay! That was awesome.
So you can clearly see you had two clinicians, a BCBA and a speech language pathologist, that were working collectively and in unison with the same individual. The best part about it, again, was that little kiddo was having fun and he was making progress. And so there's a lot that goes on with integration behind the scenes when you're working as a team. So there's the sharing of data, there's speaking to the families and speaking to the parents and talking about priorities and what is most important in terms of what they want to work on and where we can help them and how this can help them in their everyday life. And so a lot of what I do as a speech language pathologist and a behavior analyst is talk about, okay, you're the family. You have are with this individual in your lives and are working with this individual for the larger amount of time than we are throughout each and every day. And so how can we help you? What is important? A lot of what I hear is, it would be great if my child could say mama. It would be great if my child could vocalize basic needs and wants. I really want my child to make friends. I want my child to be able to sit and have a meal and have conversation with us, talk about what he or she did at school during the day. With older individuals, it might be at work during the day. And so those are really important things to understand as a clinician. And in the integrated model, all of that information helps build and shape the intervention that you're working on. And so clearly in that video, Ethan was working on vocal speech, and they were working on building his sound repertoire, which eventually will help him learn more functional words to be able to then communicate more effectively with peers, with his family, in the community, not just in the walls that comprise a clinic room where he's having therapy. So the other great thing about an integrated model is that you have service providers working together, and the goal is to generalize these skills outside of the treatment session. And if done effectively, that happens almost always. And so I think that, when you're talking about an integrated model, especially individuals working together as professionals, there's a lot of teamwork. There's a lot of, meeting going on behind the scenes. There's a lot of communication around progress. There's the sharing of data, but there's also the sharing of ideas in terms of how we can always be doing something better and perhaps in a more effective way. And so that to me speaks to like the team approach that integration really emphasizes. Okay, so again, when we're talking about integration, you obviously have to start somewhere. It's very important when you're looking to integrate speech and occupational therapy services into ABA services that you identify at the starting point what needs to be worked on. So I just mentioned coordinating and interviewing the family, the caregivers, and other stakeholders is very, very important. So during the evaluation process, you would have, those talks, you would have, case history completed, and then you would work into a structured evaluation. And so that evaluation would incorporate in a lot of times some standardized assessments, some criterion reference assessments. And what I mean by that, there's several of them that I don't feel is important to list out at length, but you have a test that gives you some data, some numbers to start with. And that really looks at giving you information on, okay, where do we start? Where does my son or daughter, or does this child, where do their skills stand currently? At what specific level are they at with respect to each and every skill that we want to work on in comparison to the normal, typical trajectory? And how are we going to get there? So not only are we establishing a starting point, but we're creating a path to success as well during that evaluation process. Then a service recommendation is made. And so during that service recommendation, it's really, really important to talk about things like how often are we going to be meeting with the child? Who is going to be meeting with the child? And when I talk about delivery model, I mean, okay, so are we going to be doing this on an individual basis, a one-to-one basis? Is it going to be in a small group? And also, is it going to be perhaps a co-treat model? So when you talk about participants, you talk about in this session for this particular individual, what types of supports does this individual need? Do they need to have a one-to-one session with a speech language pathologist or an occupational therapist with perhaps a behavior therapist there to really focus on delivery of any sort of behavioral intervention that has been recommended through the BCBA? And so as they're really working on shaping behavior, the speech pathologist and or the occupational therapist is really focusing on delivering a skilled service and working on things, for example, like what you just saw with Ethan, working on shaping his sound repertoire, or if, for example, with an occupational therapist, perhaps you're working on building skills such as activities of daily living. You might be working on shoe tying. You might be working on brushing teeth. You might be working on let's say, making a small snack. So really they're working side by side. The ABA therapist is focused on really the decreasing the challenging behaviors and reinforcing the socially appropriate behaviors. And then the other service provider, the speech pathologist or the occupational therapist, is working on delivering the skilled service. Another component to the integration is that family and caregivers are consulted or spoken with regarding the course of treatment and how we're going to implement, and we get the green light. So it's really important that while we're making and creating this pathway to success, that again, the family is on board, because if we have family buy-in, and this is something that is going to be easily carried over into the home and the community setting, then the likelihood of success is far greater. And so we really want to understand that, you know, the family dynamic, the family model, and make sure that what we're recommending is approved, so to speak, and is effective for that family and fits into that family dynamic very nicely. Then once services begin, you're constantly speaking about performance, and this typically happens at a set interval of time. So usually we like to do this monthly, where we bring everyone together, specifically the parents and the clinicians working with a particular client, and really discussing, okay, we developed that baseline, we developed that starting point, and now here's all of the progress that we've made. And then with that, here's where we intend to go within the next monthly interval. And when we come back to the table, we hope that we're going to show more progress. And as you all hear, anyone here who's received ABA services before, you know that we're very firm believers in providing data that's visual. And so you would be reviewing graphs of that and really having something to walk away from, a permanent product of your child's success. And if we're finding that something is not working, that's also discussed at that point too. And really we talk about maybe a new course of action or a better course of action that will work more in line with your child's strengths and learning preferences. And specifically, strategies for success and skill acquisition, or the development of new skills or refinement of skills, are shared among all providers. So again, we don't want people to be working in silos. The whole goal of integration is to ensure that everyone is working in unison. Everyone is working, you know, with the understanding of what each person is working on, and we're all working for the same common goal, and that's to provide the best possible practices for the individual, and to make sure that they are becoming as independent as possible and are able to generalize these skills outside of the session and outside of the treatment room. Okay, we have our first question. So Emily is going to go ahead and launch this question. And the question is, it's true or false? Integration occurs when only specific members of the interdisciplinary team are part of the process. And I see, wow, everyone is responding very quickly. So I'll give some time. Let's see. All right, so we have 53% of you, moving up to 57%, have said false, and about 43% have said true. So this can be a little tricky. Now people are kind of moving more towards false. So yes, the answer is false. We don't want to be, you know, very specific in terms of who we invite to the table. We want to invite all stakeholders to the table, right? So anybody who has an investment in this child's learning, anybody who is potentially working with this child in some capacity, you know, it's not an exhaustive list. Of course, there are a number of individuals that could potentially be working with any given child at any given moment. However, it's important to make sure that anybody who is working with this child is there and is communicated with in terms of the plan of action. And so you want to ensure that all members are present. And again, that includes teacher, parent, BCBA, speech pathologist, occupational therapist, physical therapist. It's really important that all players are at the table, and also to provide input and insight into the best course of treatment. There we go. So is integration effective? Yes, when done correctly, absolutely. And what do I mean again by correctly? You have people communicating with one another. You have people sharing data You have people establishing a course of action and really working for the same common goal. It is effective when people are doing all the things that they need to do to ensure its effectiveness. And so when you have people, again, I mentioned this before, working in silos, it won't be effective. And so some of the ways that it can be effective, or an example is, again, in Ethan's video, it was a great example of effective integration. Some other examples of how providers can work together. And I do this a lot at Verbal Beginnings, and I've done this a lot in the course of my career, where I might provide some consultation. So really the difference between direct intervention or direct treatment and consultation is that if I'm consulting to another provider, they might be asking me questions and advice on what they should do. And so some of the ways that I do this at Verbal Beginnings to date is I might discuss with the Healthy Beginnings program. I might go in as a speech pathologist and I might talk to them about certain clients and what I might recommend for them to teach a client how to chew, for example, and the prerequisite skills leading up to an appropriate chew, and what is typical of a mature chewing pattern. And so I might give them some advice, having done an observation and working with the parents and understanding the parents' plan and what they desire for their child. I might go in and I might sit with them and say, okay, my thoughts on this are X, Y, and Z. So I might provide consultation. Another way integration can be very, very effective is specifically, I've actually had to work with occupational therapists on individuals who are looking to acquire augmentative alternative communication systems. And what I mean by that, for any of you who don't know, is a speech generated device, or in some cases, you might see individuals using an iPad or a device that looks similar to an iPad, where you might press a button and that will elicit a voice. And so because they do not have vocal speech as a method of communication, they might be using this to supplement that. So a lot of times I might consult with an occupational therapist or perhaps do a co-treat to really ensure that the device is set up appropriately. So there are things related to scanning that an occupational therapist is very, very well versed in. And so when it comes to setting up different colors on the screen and different fonts, different background colors in contrast to the color of the button, that is very, very helpful for an individual using a device. Sometimes you need more contrast, sometimes you need less contrast. So when you're looking at that, an occupational therapist from a visual perspective can offer a lot of feedback and a lot of great information on that. Another way an occupational therapist can be very, very impactful is I've actually worked on a team where we had an individual, excuse me, who was prescribed AFOs, or orthotic devices to help strengthen the Achilles tendon in the back of their legs and to help them, minimize their toe walking and really getting them to stretch their feet. And the occupational therapist was just brilliant in terms of what she recommended. And unfortunately for this individual, initially the wearing of those AFOs was very painful and very aversive. And so there was a lot of challenging behavior. There's a lot of aggression. There was a lot of property destruction being witnessed by the team. And so the OT was just amazing in terms of making recommendations for the BCBA and myself during sessions, and how we could make the individual comfortable and how we could really build up that level of tolerance to those to wearing those AFOs. So that was a really wonderful experience that I had. Again, and from a flip side, BCBAs can be really impactful in individual sessions that we might run as speech pathologists or occupational therapists as well. I have had such great meetings with BCBAs in terms of advice and or them co-treating with me and showing me how I can increase attending, so that way I can really work on building up someone's sound repertoire, or even really focus on in-seat behavior so that they can sit down and they can learn that skill of being able to sit, focus, and then listen to a conversation and be able to volley back and forth and answer questions and ask questions. So there are a number of different ways that this can work, again, when done effective. And it's just when you're a part of it and you see it happening and you see the progress that the client is making, and again, that it's fun for all parties involved, it's just It's something that I think that anybody who is in this field can really appreciate. And I know that the parents do as well. So integration at its best. I love this photo because I think of, autism services in and of themselves as kind of like this circular, the circular shape. It's one big circle, and within that circle are all these little component parts. So not every individual diagnosed with autism looks the same, acts the same, has the same strengths, has the same weaknesses, has the same family dynamic, and has the same symptoms perhaps of another underlying disorder. And so, when you look at an individual with autism, there are so many more layers to this individual. And there's also, in essence, variability that occurs hour to hour, day to day, based on what their own makeup is. And, when you're looking at integration, you really want to ensure that you are understanding the entire person. And with that, family dynamic is also super important. And so, I like this diagram because, again, within that, diagnosis of autism, there can be other, what we would say, comorbid or other diagnoses that are that exist or could be potentially being diagnosed, that also you have to take into consideration when treating an individual. And so, it's really important when you're developing any sort of course of treatment to understanding to be doing your job correctly. You need to understand the individual and everything that they potentially are struggling with. And so, this diagram to me, or this picture to me, really speaks to that. So question time again. So you're going to choose the best answer now. So in order to effectively treat an individual with autism, the team needs to treat, and you're going to pick the best answer, the autism diagnosis, the individual, only what is observable, or the individual according to individualized needs, include all stakeholders. Wow, very good. Quick figures. Great. Give about another couple seconds. Okay, so we have 90% of individuals who say, yes, you're going to treat the individual according to the individualized needs and include all stakeholders. It's a little tricky because, yes, you want to treat the individual, but again, when you're talking about integration, you are not just treating the individual, you're including all stakeholders. Because if we want to ensure that generalization of skills, meaning taking those skills and being able to demonstrate them outside the four walls of a treatment room, you really have to ensure that the people on the outside of those walls know what's happening and know what's going on. And so including all of those individuals and allowing them to have a seat at your table is very, very important. And again, going back to the diagram I just showed you, each individual diagnosed with autism is unique in their own way. And so you want to ensure that you're not just flipping through, what you would consider, a recipe book and say, okay, this is how I treat this, and this is how I treat this. You really want to tailor your intervention and what you're working on to the individual, their needs, and also, make sure you're sharing all that information to the people who are a part of this individual's life. Okay, so I included this study because I think that a lot of times people provide information and they forget to talk about potential barriers. Not everything is perfect, and you can potentially have barriers to success, specifically when you're talking about integration as well. And so, some barriers from a clinical perspective is you could have people who are really, really, they're very well versed in a particular way of doing something or a particular intervention, and they are just very steadfast and they're holding their ground and they think that this is the best way to do it. They don't have that kind of integrated approach or maybe an open mind because they've been in the field for so many years. That can potentially be a barrier. And so, that's what I'm talking about. There are other barriers as well that, may exist. And so this particular study that was done by Duquette, Charbonneau, Ralt, and Crevier in 2016 really spoke about, they reached out to parents and caregivers of individuals with autism, and they were talking about, if we want these individuals to be successful in the community and we want them to be able to, participate in soccer, and they listed out badminton, which ironically is like one of my favorite things to do. I don't play competitively or anything, but I think it's a great addition to any picnic you go to. So if they want, if you think badminton in a picnic type atmosphere, running, dancing, football, hockey, swimming, anything that has to do with a community-based activity where you can make friends, you can build skills, but language is heavily embedded in there, and social behavior. This study was really great to me because they looked at potential barriers as it related to working with the parents and what was addressed. And so this particular slide looked at the age of the students, 9 to 21 years old, and then the sport that they practiced in the community, and then the parent type. So the parents were either a mother of one child with ASD or a mother of two children with ASD. And then the caregiver's profession were actually a special educator or school and social adaptation teacher. They did have some education within the field, right? And so, it's so funny because I think that sometimes when you're talking with particular individuals, I always laugh about this because when I'm talking with parents or I'm talking with other educators and they ask me advice about their own kids or, what I do with my kids, and they're like, wow, you have it so together. Oh my goodness, everything must be, I think they have this idea that everything's perfect at home, and that is not the case. I always say to people, okay, do you want, SLP, BCBA Stephanie advice first, or do you want parent Stephanie advice? And so, where everyone is a person at their core, and all parents are parents, right? And we struggle in very different ways. And so I think that this study I really loved because even the people who work in this field and have education in this field, we still have issues and we still experience barriers as well. And so I really loved this because those parents were part of the study. Okay, and so before I go to this, I'm so sorry. I skipped the slide for some reason. I just want to go back really quickly. Okay, here we go. So after speaking to the parents and talking about this, they identified some of the barriers. And so some of the barriers, and I can relate to a lot of these as a parent, who focus on competitiveness. So what is it that we're trying to teach these individuals? And so some of the caregivers, the coaches, the teachers, the educators, the parents were saying, yeah, they're really just focused on winning. They're not really focused on making friends, working together as a team, group instruction, being able to, listen as a group, be successful as a group. They're too close-minded. Like I was referencing earlier, they have their vision and they're not allowed to think outside, or they're not allowing themselves to think outside their small little box. They have a lack of knowledge about the diagnosis of autism in general, which a lot of times is the case. And I don't feel that there's an unwillingness to learn. What I do feel like happens is that people stick within their comfort zone. And if they're not provided the information, they do what's easy or they do what works or they've known to work in the past, but that can also be a barrier. So, training is of the essence when it comes to, a lot of this here. So I would say lack of knowledge, but probably what could go on here too is a lack of training. And then also a lack of resources. This happens a lot in the school system, especially in some of the areas where I've consulted and tried to create an integrated approach within the school system. Large caseloads, very limited resources, and a lack of time creates issues and creates barriers. And in a perfect world, you would want to have that additional time for more training, being able to work collaboratively. And that actually creates a really firm way to present the idea for integration, because you actually are able to use your time more effectively and more efficiently. And then when they looked at their peers, some of the barriers were intimidation. unfortunately, some of the challenging behaviors we experience as clinicians, we have to look at the impact of those behaviors, and parents see this impact of those behaviors on peers. I have a 3-year-old, his name is Santino, and my husband owns a boxing gym, and Santino is still trying to discriminate when punching is appropriate. And so last week, a week and a half ago, I got a phone call from the teacher, and Santino had punched a peer in the classroom because she wasn't listening to him and he was feeling frustrated. And so again, I experienced the same types of behaviors. And so I had to work through that, right? They were very gracious. Santino wrote her a card, apologized. We worked through it. We were able to talk through it. But again, that can create some intimidation for that little girl. And perhaps she may not want to befriend my son on the playground later on. And so, these are real life issues here in terms of barriers. Again, lack of knowledge, lack of awareness, that can also be on part of their own parents, the peers' parents, and inadequate integration of the young person with ASD with peers. So I think that, when part of integration is really, again, looking at generalization, and what you're really trying to focus on is how are we allowing this individual to be as independent and as successful as possible. Part of that is incorporating peers, whether they are peers also with ASD or whether they are neurotypical peers. Both are very, very important. In terms of parents, some of the barriers were they didn't engage in sport and physical activities. They weren't really understanding what the requirement was. They had a lack of time. I feel like we all feel this as parents. You wish you had, 30 hours in a day as opposed to 24. A lack of energy. I feel this. A lack of resources again. And then there were some others that were identified: availability of activities, the type of activity, the transition, of course, and a lack of support. And so again, what's great about this study is that they looked to speak to all stakeholders to be able to understand the situation, to be able to create a plan of action. And this is how you know when good integration is occurring, or the setup of good integration is occurring. This is how you avoid these barriers. You look at the bigger picture, you look at the end goal that you're shooting for, and you include all stakeholders from the beginning. So that way you're creating a path towards success, and one where there's more success along the way, as opposed to issues or an individual feeling that they're not successful. Okay, another question. So you're going to choose the best answer. So all of the following: parent, teacher, sibling, SLP, BCBA, OT, ABA therapist, are potential stakeholders in the treatment of an individual with autism, except. Perfect. People are jumping right out the gate and answering this one. You've been paying attention. Excellent. So 100% of you so far, and it's climbing, are saying, 92% now are saying that all are potential stakeholders. Yes, all are potential stakeholders. And 7% of you said that the ABA therapist may not be a stakeholder, but no, it's very important to include the ABA therapist, because they're actually the individuals who are working hands-on with the child, specifically in a center-based service, at a center-based service provider or an in-home provider that's delivering ABA services. They're really the probably I consider them to be the most important person with respect to the team. And so I really want them to have a seat at the table, because their information and feedback is invaluable. So we want to incorporate all of these individuals. All right. So now what a lot of you are probably hoping to hear is an update on comprehensive services. So again, integration at its core, when done correctly and effectively, is fun and successful. At Verbal Beginnings, we are really looking at creating a full wraparound model and incorporating occupational therapy services and speech therapy services into our ABA services that we've already been providing. And so in May, next week actually, Private pay speech services are going to start for the center-based clients at Verbal Beginnings. And so I'll be flying out from Massachusetts and visiting. It'll be my second trip to Maryland I have a list of individuals. We've reached out to parents. And so the first round of individuals that have identified that they want to partake in private pay speech services with the ability to submit to their insurance company for reimbursement. And I can also, if you're interested, you can provide your information to us and we can talk more offline on how to do that. But that will be starting next week, which is super exciting. And I'm very excited to be out there in the centers again and be working with some of the clients there. And then in June, we have a full-time speech language pathologist and a full-time occupational therapist joining our team. And the occupational therapist will be starting on June 20th. And so our private pay OT services will be starting as well for center-based clients. I think it's important to note that we are doing the private pay option so that we can get these services up and running as quickly as possible and get access for the families where this option works for them sooner rather than later. And so then in fall 2023, that's our targeted time frame for credentialing with insurance providers. Some of you, I'm sure, I've been in touch with several times. And so it is a process by all means, but insurance providers are very open to this integrated approach. And so we're moving through the process and we're shooting for a fall timeframe to become credentialed with insurance providers. And then and that's for our center-based services that we would continue to offer those services to all of our center-based clients initially. And then in early 2024, that's our targeted timeframe for outpatient speech and OT services to be able to be offered to our field-based clients. At that point, we would have both the private pay option and we would have the insurance-based option for individuals to come into the center and to be able to receive speech and OT from our, lovely team that we have in the comprehensive services department. So that is our lofty plan, and it's moving along very nicely. And it's been an amazing trip for me so far since February. And I'm really excited to see what's in store and how everything continues to move accordingly. So now we have about 14 minutes left. And so I'd love to open it up to all of you for any of the questions you might have. And I'd love to be able to answer them for you. And Emily is going to run through them for me.
Yes. Awesome. Thank you, Stephanie. Okay, so one of the questions you briefly touched on the insurance piece of it, but I did have a question that was specific to what type of insurance that you're planning to accept. So I'm not sure if you have any of that information just yet.
So I know a couple of them. Again, I'm from Massachusetts, so the insurance options are a little bit different from state to state, but that is something very specifically you can reach out directly to our finance team on. A couple of the ones that we are currently in talks with, are Care First, Cigna, Aetna, Optum, United Healthcare. So those are some of the examples. It's not an exhaustive list by any means. And so if there's specific questions around that, by all means, you can reach out to our finance team at Verbal Beginnings, and they can give you more specifics around that.
Awesome. Next question I have here is, how can I schedule a consultation?
There's a couple of different ways actually. And so I have been offering, if you're a parent, for example, of a child and you want more information or you want to have a conversation, you can feel free to contact me directly. I believe I don't know if my email, Emily, was provided here on these slides, but we can provide my email to you all, and you can feel free to reach out for more information or schedule a phone call. If you are a service provider, a BCBA, an occupational therapist in the field, and you want to talk, same thing, you can feel free to contact me. If you are an internal employee through Verbal Beginnings, we've created a referral form that actually the VP of Quality Assurance, Rebecca Womack, is reviewing. And once we put the finishing touches on that, we'll be able to have individuals from within our own company be able to schedule consultations and such. And so we're working on ironing out the processes internally from a company perspective. But if you are a parent or you're an outside provider and you'd like to consult, feel free to contact me either by phone or email.
Awesome. Next question I have here is, and I'm not sure if this is information that is available to the public just yet, but how much sessions are for private pay services?
So that's something, again, you can reach out directly to our finance team. They have all of that information. We really strive to keep like clinical and the finance stuff separate. So they have they have all that information laid out. So you can reach out to them directly for sure.
Great. One question I have here is, can the speech therapist or occupational therapist integration services be included within non-center-based patients?
So for example, field-based clients?
I would think so, yes. Or probably anybody outside of there just looking for maybe speech or OT.
Yeah, so that actually is part of our initiative, and that absolutely is something that we are targeting, and we're targeting that for early next year. So we're trying to get everything ironed out and streamlined for all of our center-based clients first, and then anybody who is a field-based client from Verbal Beginnings, we then looking to include you and offer that as a service. And then we would look to see, okay, as an outpatient service for people who are not receiving ABA services, what that would look like. But yes, that's on the horizon for next year.
Great. The only other question I have right now is what centers that we're currently accepting center-based kiddos, not specifically for speech or OT, it doesn't say. So I'm just going to rattle off the different areas in Maryland because this person lives within the Maryland area. So we do have our centers in Columbia, Maryland, Millersville, Maryland, as well as Rockville, Maryland. And there's a bunch of information also on our website, so you can check that out as well and see some different pictures of what the different centers look like. I think we have a nice virtual tour on there. And you can also contact our intake team for more information about availability.
And just to let everyone know too, we are going to be offering speech and OT at all of the centers in Maryland.
That's awesome. Thank you for adding that. That's great.
Yeah, the only center I won't be seeing next week is Rockville, but just because it just opened. But we will, again, if you're a current, if you have a son or daughter that's currently attending and receiving ABA services through Verbal Beginnings, we will be sending out another parent interest survey. And so if you didn't complete it initially, or you're new to Verbal Beginnings and you didn't have the opportunity, we'll be sending out a parent survey as well. So please complete that, because I can track those answers. And if you're a new person to our list, we definitely want to make sure that we can reach out to you and get you on our list of people to start services with.
Thank you. And we have a question here about what ages do you offer services for? My assumption would be for this being a center-based question, so that would be 18 months to 6 years of age.
Yes, that's our current age range, correct.
And I assume speech, OT, all of that fits within the same age range, right? There's no limitations on that?
Correct, yes. Currently, since we are folding these services within our ABA model under our autism services umbrella, it would be for that age range.
Awesome. Thank you. Oh, it was a question specifically for ABA therapy. So yes, same applies for ages, would be the 18 months to 16 years within our centers. And then we offer field-based services up through the teenage years. So beyond the 6 years of age as well.
And when we're looking at our kind of trajectory of, rolling out these services, again, once we open this up to the fields, there would not be an exclusion based on age. So, that, just so you know, that when we get to the point at which we can offer these to field-based clients who are receiving ABA, then, then we would offer them, regardless of age.
Awesome. I have a couple questions coming through here. One question is, will this meeting be recorded and sent out via email? I had a scheduling conflict and was able to jump off. Totally fine. We do record this, and within the next couple of days here, we do send it out to all registrants. So you should be able to get this link to our webinar this evening within the next few days here. So just be patient with us, but we'll get it to you. It's a great question. And another question that we have here. My son is currently enrolled within VB. We've been told that VB is currently awaiting accreditation. Is there an update on that? I might need a little bit more information, unless Stephanie, you know what is being referenced to.
So I think the term accreditation, I think maybe is you're referencing credentialing. And so the credentialing process with the insurance companies, we are having those conversations. Currently, again, it is a process. So the update is that we're rolling out the private pay option with the intent for individuals to be able to submit to their insurance company. And again, it's a process. So not to get too much in the weeds around that discussion, I can definitely have more of a more detailed conversation offline, but you can submit to your insurance company potentially to get reimbursed. And why we're doing that is because there are so many people that are kind of competing for these spaces to become in-network. And so we want to assure the insurance companies that we are providing a really exceptional service. We're doing this integrated model. It's very effective. We have clients receiving the services, and that will better help us move along the process a little bit more smoothly with them in terms of, understanding the type of services that we provide and being able to show them, hey, we're currently doing this. And so can you help us move through this process a little bit more quickly? And so that's that. So in terms of like time frame, again, I'm saying fall is when that credentialing will take place. It could happen sooner. It could happen, at the beginning of winter. It just really depends on the specific provider, and each provider has its own requirements to become credentialed that we as an organization need to meet. We're definitely looking at each, list of requirements very detailed and specific. And our finance team is actually the same team that is having those talks with the insurance company. So I wish I could give you a definitive answer and a definitive date, because I know that would actually make my life a lot easier and make me happier. But unfortunately, they don't give that information to us. However, again, we still are shooting for that fall 2023 timeframe.
Awesome. Thank you. I have another couple questions, some great questions that came through here. One participant asked, if your child receives field-based services currently and also participates in private OT and speech language therapy, how can we go about fostering more integration between all of these service providers? I love that question.
I do too. And actually, it's so awesome that you asked this, because this has been coming up pretty regularly. I just had a conversation with a parent today about this as well. So one of the things that we will do and are going to do is that we really want to provide more coordination of care opportunities. And what I mean by that is opportunities for all of the stakeholders to come to the table, even briefly, to be able to discuss what's going well, strategies that we can kind of all share across the board to ensure that everyone is working to the same common goal. And so if you are a parent of an individual who receives outside services, we have reached out to certain families to say, hey, this is something that we're eventually going to offer. You are more than able to receive these services from us, eventually in the future. However, in the meantime, let's create a plan for all of us to be able to coordinate care. And some families even want to pursue services under the umbrella of Verbal Beginnings once they're made available. They still want to keep that outside provider involved. And that's okay. We can do that. We would just set up a system for coordination of care. And that is something that myself and the Vice President of Quality Assurance, Rebecca, and also Rebecca Larson, the Director of the Centers, and Emily, the Director of Field-Based Services, we're actually all currently working on. So we really want a nice, really fine-tuned system for how we can all coordinate with outside providers to have more opportunities to share, the positives that are happening, and to really ensure that that we can, have better skill acquisition and better rate of acquisition, because we're all working towards that same common goal. So stay tuned on that for more information in terms of how that would look, because we are creating that system currently.
Thank you. And question I have here is, if we opted for the private pay option, how would these services be integrated into his existing schedule?
Great question. So what we would do is you have your center-based schedule. And so we would schedule the services during that time. So I'm actually working with the scheduling team right now with respect to when they would happen. So it wouldn't be something else you would have to bring your child to. Your child is at the center. It would occur during your child's center time. And then you would then have the opportunity to meet with the service provider during a set time each month during a coordination of care meeting to be able to talk about progress and what's being worked on and answer any questions. We also have the ability to share through our platform of Central Reach progress and also like short video clips and stuff. And so some families are like, I love this because I have other children and I know that they can get the services. They're in good hands at Verbal Beginnings. Everyone's working together. It'd be nice to have maybe like little snippets of information along the way so that I know what to come to the table with when I have those sit down meetings and we're talking about progress. And that's what we aim to do. So that is essentially how it would work. It would happen during their center time, and then you would be provided information on progress and such throughout the course of the month. And then you would have a set time where you can schedule with a service provider, 15-minute window each month to really talk about progress, performance, and kind of what we're looking to do as a plan of action moving forward.
Awesome. Thank you, Stephanie.
Yeah.
We're at the 6 o'clock mark. Before everyone signs off, do you mind just skipping over to that last slide just so I can let everybody
Sure.
know what to expect for next month? Thank you.
Absolutely. Yeah, no problem.
Awesome. So for next month, stay tuned. We have our director of our Healthy Beginnings program, which is our feeding program at Verbal Beginnings. He will be doing an awesome presentation for us on the importance of nutrition in relation to autism spectrum disorder. And he'll be doing a brief review of the research out there, and he'll be available just like Dr. Nostin was this evening to ask some questions. So I hope to see you next time. And I can't thank you enough for joining us this evening. Dr. Nostin, thank you so much for gracing us with all this amazing information. And we hope to have you back really soon. Thank you, everybody.
I would love to come back. Thanks, everyone. Bye.